Deglutition. It is also called as swallowing. What is meant by defecation? The process of excretion of the fecal matter is called defecation. What is meant by homeostasis? Maintaining the constant internal environment is homeostasis. What is hemostasis? Arrest of bleeding is called hemostasis. Always you will have the confusion between homeostasis and hemostasis. But it is fine if you have confusion between hemostasis and homeostasis. But don't have confusion with defecation and deglutition. Okay, this is swallowing of food. That is excreting the fecal matter. Okay, one of my students during the Viva session, the question was, what is defecation? The answer which I got is the process of swallowing of food is called defecation. Okay, so remember this, they are similar terms, but it is giving a big difference when you say the answer. Okay, defecation is different, deglutition is different. You cannot mix that in any point of time at any cost. Okay, clear? So now what we are going to see is deglutition. So deglutition is the process of swallowing of food. So this deglutition, just swallowing in single word we are telling, but it is having three major phases. Oral phase, pharyngeal phase, and esophageal phase. Okay, so deglutition is the food bolus from the mouth. It is going to travel into the pharynx, then it is going to enter into the esophagus. So the events which is happening between the mouth until it enters into the pharynx. So based upon these three regions, we are terming it into oral phase, pharyngeal phase and esophageal phase. Okay, for the things which is happening in the oral phase, that is from the mouth into the pharynx. The bolus is going to enter from mouth into the pharynx. So first thing which should happen is the upward movement of the tongue. The tongue should move up and hit the palate. So the movement of tongue. So this is your palate and consider this as your tongue. So this will give upward movement. Then what happens? The bolus which is present in your mouth is going back. Once when the tongue moves up, it is making the bolus to move backwards. Okay, so this oral phase is being the bolus voluntarily pushed. In the oral phase, what is happening is there is voluntary pushing of bolus from oral cavity to the pharynx. Okay, it is happening by the upward and backward movement of the tongue against the hard palate. Clear with the oral phase? Yes? Okay. And next, now the bolus reached into the pharynx. Pharynx is the complicated structure where you have the connection between the trachea and the esophagus. and there you have the vocal cords. Okay, and that is the place where there are so many major vital structures organized. So you have to prevent the bolus entering into the trachea. Okay, so this pharyngeal phase, what is happening in the pharyngeal phase? It is what is happening first once when the food enters into the pharynx. Now the bolus is in the pharynx. Okay, so what is happening first? The walls of the pharynx is getting contact with the food. Contact of food with sensory receptors of the pharynx. Okay, it is at the posterior aspect of your tongue and pharynx. At the posterior aspect of the tongue, pharynx, soft palate. So all these structures getting contact with the food. So the sensory receptors is now getting the signal that the bolus is present over here. So it makes the pharynx to swell in order to receive the bolus. So up to that, the bolus is over here in the oral cavity. Before the end of oral phase, the pharynx is in a contracted state. So during swallowing, it will just make its structure big to receive the bolus. If this stretching is not taking place, the food gets stuck in the oral cavity itself. Okay, so how the stretching is taking place? It is because of the presence of sensory receptors. What are all the structures the bolus is travel? What are the structures it is crossing? At the back of the tongue, you have the soft palate. Then you have the pharynx, oropharynx, nasopharynx, laryngopharynx. We have three regions in the pharynx. Okay, so it is going to travel to the entire regions of the pharynx. So all those regions should enlarge in its size to receive the bolus. So for that, it should have the sensory receptors. It is receiving the signal, and those sensory impulses, how it is traveling. The sensory impulse is traveling through, what is the fifth cranial nerve? Ninth cranial nerve, and again the 10th cranial nerve. Okay, so this three cranial nerves is the one which is receiving the sensory signal, and it is going to give the signal to the swallowing center. It is in the medulla. What happened? Okay, clear? So it is going to give the signal to the medulla, and from the medulla, now the sensory is over. It is going to give the motor signal. Once when the sensory is giving the signal to the higher center, from the higher center you will get the motor response. So this motor response is going to be carried by the fifth cranial nerve. Which is the fifth cranial nerve? Is it a sensory nerve or a motor nerve? Mixed. So it has sensory component as well as motor component. You should always keep in your fingertips. It should be always in the tip of your tongue. The cranial nerves, which is sensory, which is motor, which is purely sensory, purely motor, and mixed cranial nerve. You should not think. Okay? You should think only during the first year of your medicine. Not now. Okay? It should be always in the tip of your mouth. Clear? So, trigeminal nerve, mixed cranial nerve. The sensory component is involved in giving the sensory signal to the higher center, and the motor component is taking part its role in giving the motor response. Not only the trigeminal nerve, you also have the facial nerve and the 12th cranial nerve. Which is the 12th cranial nerve? Hypoglossal. Okay. So the tongue, pharynx and the oral cavity now making the bolus to go into the pharynx. Okay. So finally what happens? The motor signal, it makes the pharyngeal muscles and tongue to do its function, especially contraction of the pharyngeal muscles. Okay. And one important feature which you have to remember in this, because pharynx is the complicated region where you have the trachea also, the epiglottis. Okay. What is the nature of an epiglottis? It is not having any fixed rigid structure. It will be keep on oscillating. When you are talking, it will oscillate and prevent the, it closes the esophagus. And when you are eating, it closes the trachea. Okay. So what happens is, this epiglottis, which is present over here, and you have the trachea in the anterior part and esophagus in the posterior part. This is the epiglottis. This will just close the trachea. So what happens? The food during the pharyngeal phase, it enters into the esophagus and it is being prevented from the entry into the trachea. So in the pharyngeal phase, epiglottis plays a major role in the entry, preventing the entry of food into the trachea. Okay, clear? And then next one, now the pharyngeal phase is done. And now we are going to enter into the esophageal phase. Clear? Yes? So esophageal phase. So in the esophageal phase, before going into the esophageal phase, during pharyngeal phase, we have seen there is stretching of the pharyngeal muscles. So everything is made up of smooth muscles. Once when the stretching is initiated at the pharyngeal phase, this will travel towards the entire end of the GIT until it reaches the anus. So that kind of movement is called as peristaltic movement. So this peristaltic movement will always be present from the oral phase, from the mouth until the anus. It will travel in the cranial to caudal end, but it will not travel in the reverse way. Okay. So this peristaltic movement is one of the important peculiar function which is happening in the GIT in pushing the food bolus from mouth until the anus throughout the entire digestive process. Okay. Apart from this, different organs is having its different movements in pushing the food from one segment to the other segment. But wherever it is, once when the peristaltic wave is initiated in the pharynx, it will travel in small lower strength until it reaches the anus. So that is called as the peristaltic wave, which is beginning in the stretching of the pharynx to receive the bolus, that you call as primary peristaltic wave. It is a continuation of the peristaltic wave from the pharyngeal phase. And now the food entered into the esophagus. The bolus entered into the esophagus. So whatever stretching happened over here, now this part will be relaxed and the adjacent part which is going to receive the bolus will stretch. So this is the stretching which is taking place at the esophagus. So that is called as secondary peristaltic wave. This begins in the esophagus itself. So this will be there until you have the lower esophageal sphincter. In esophagus, you have upper esophageal sphincters and lower esophageal sphincters. So the movement of bolus from pharynx into the esophagus makes the upper esophageal sphincters to open, and the lower esophageal sphincters, during the persistency of the secondary peristaltic wave which has been initiated in the esophagus makes the lower esophageal sphincters to open. So the food now entered into the stomach. Okay, the bolus now enters the stomach. So for this, you need the opening of lower esophageal sphincter. So this is very important thing, lower esophageal sphincters opening. So this should close when there is absence of bolus, but it should open when there is a presence of bolus. If this is not working in either way, that results in some clinical scenarios. The one which is called as aclasia cardia. What is this? It is due to the opening of sphincter or non-opening of sphincter? Non-opening of sphincter. If the sphincter is not opening, even though if there is a bolus hitting the esophageal side of the sphincter, then what happens? The bolus will get accumulated over here. So that will give you epigastric pain, epigastric disturbance. You feel something is hitting. And finally, then what happens? You feel difficulty in breathing. Because once when this esophagus is getting accumulated with the food bolus, the adjacent structure what you have, the lungs, then the heart, based upon the severity of accumulation, it will go and disturb the adjacent structures. So this is due to the absence in the opening of lower esophageal sphincters. So that is called as aclasia cardia. So what is the significant diagnostic investigation we will do for this? Barium swallow. X-ray, you will find the barium swallow. What is the peculiar feature you will see in this? What kind of appearance? Bird's beak appearance, like this. This is how you will have the stomach and the esophagus. So in this region, when you give the barium swallow, the lower esophageal sphincter is closed and all these will be accumulated and you will have this bird's beak appearance of the enlarged esophagus. Okay. So bird's beak appearance during barium swallow, it is aclasia cardia. Okay, clear? And the other one is when the sphincters is relaxed without any stimulus. This why this lower esophageal sphincter is taken into a consideration to a higher level is because it is the one which is giving the connection between the stomach and the upper GIT. Okay, because stomach is filled with the highly gastric juice called as HCl. This is highly acidic. Only the walls of the stomach is having the ability to withstand its acidity. The walls of the stomach is having rich mucus secretion. So it protects the inner lumen of the stomach from the auto-digestion by the HCl. But in the esophagus and also at the next to stomach, you have duodenum. You have here the pyloric sphincters. Okay. So after this also, you don't have the rich mucus secretion. So this HCl can be present in the stomach without any auto-digestion because the walls of the stomach have 3 muscle layers, that is oblique layer which is present only in the stomach, not in other GI systems, and stomach has rich mucus secretion which protects the inner wall of the stomach from the digestion with the HCl. If the lower esophageal sphincters is opened always, then you will have the backflow of HCl into the esophagus. What is the condition called as? What? Gastroesophageal reflux disease, GERD. Okay. So that is why this lower esophageal sphincter is taken into a consideration of higher importance. Clear?